Hello, my name is Luissana Intriago. I talk about Ticagrelor versus Aspirin in acute stroke or transient ischemic attack. Definition: Transient ischemic attack or TIA is when blood flow to parts of the brain stops for a short period of time. Overall, stroke can be divided into two main types. The first type, known as a hemorrhagic stroke, happens when an artery in the brain bleeds. This kind of strokes may be caused with an aneurysm, a bubble in the artery wall, that bursts, or by a condition called arterial venous malformation. The second and most common type or stroke, known as ischemic stroke, occurs when a blood clot blocks an artery that carries blood to the brain, deprived of oxygen.
A stroke is a medical emergency. Strokes happen when blood flow to your brain stops. Within minutes, brain cells begin to die. There are two kinds of stroke. The more common kind, called ischemic stroke, is caused by a blood clot that blocks or plugs a blood vessel in the brain. The other kind, called hemorrhagic stroke, into the brain. Many strokes, or transient ischemic attacks, TIAs, occur when the blood supply to the brain is briefly interrupted.
Symptoms of stroke are sudden numbness or weakness of the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden severe headache with no known cause.
If you have any of these symptoms, you must get to a hospital quickly to begin treatment. Acute stroke therapies try to stop a stroke while it is happening by quickly dissolving the blood clot or by stopping the bleeding. Post-stroke rehabilitation helps individuals overcome disabilities that result from stroke damage. Drug therapy with blood thinners is the most common treatment for stroke.
There are two broad categories of stroke. There is what is called ischemic stroke. The brain is deprived of blood supply. The human brain requires a constant supply of well-oxygenated blood. And if it's interrupted for more than a few moments, the brain begins working inappropriately, or quits working, if you will. If the brain goes for more than a few minutes without blood, it actually dies. Because unlike other organs in the body, the brain does not have the ability to store oxygen and glucose. It gets it from the bloodstream. A second type of stroke is called hemorrhagic stroke, and that's when there is actually bleeding into the brain or the space around the brain. And that can occur from a variety of conditions, such as chronic high blood pressure, which can weaken arteries in the brain and cause hemorrhages. One of the more common causes of bleeding into or around the space of the brain are brain aneurysms, weak spots in the wall of a blood vessel that balloon out and can burst and bleed. A hemorrhagic stroke, where there is actually bleeding into the brain or the space around the brain, typically presents with the sudden onset of the worst headache of one's life. If one has to wonder whether their aneurysm bled, for example, it probably did. It's usually an unmistakable event. Sometimes a brain aneurysm can cause symptoms prior to rupturing and bleeding. If an aneurysm is enlarging prior to bleeding, it can put pressure on cranial nerves within the brain and cause double vision or altered vision, and on rare occasions that can be a warning sign, but usually it's a sudden onset of a severe headache. Ischemic strokes, strokes caused by a lack of blood flow to the brain, are frequently preceded by what's called a transient ischemic attack, or a
Applications in medicine. The acute stroke or transient ischemic attacks treated with aspirin or ticagrelor and patients outcome Socrates. Trial was decided to compare ticagrelor with aspirin with regard to their effectiveness for the prevention of major vascular events, a composite of stroke, ischemic or hemorrhagic, myocardial infarctions, or death. over a period of 90 days in the treatment of patients with acute cerebral ischemia. The FDA indication for Ticagrelor is reduction of the rate of cardiovascular death, myocardial infarctions, or MI, and stroke in people with acute coronary syndrome or history of myocardial infarction.
Primary prevention of stroke requires the management of atherosclerotic risk factors, such as hypertension, diabetes, smoking, and dyslipidemia. As the risk increases, secondary stroke prevention factors include identifying whether or not the patient has suffered from prior transient ischemic attack, stroke, coronary artery disease, peripheral vascular disease, asymptomatic carotid stenosis, or atrial fibrillation. All patients with ischemic stroke or transient ischemic attack should be on antiplatelet therapy or ASA for secondary prevention of recurrent stroke unless there is an indication for anticoagulation or a contraindication to ASA. Anticoagulation long-term with warfarin is the superior antithrombotic if atrial fibrillation or other definite cardiac source of embolism is identified as the cause of stroke or TIA. Surgical intervention is very effective in the prevention of stroke in symptomatic severe internal carotid artery stenosis. Earlier intervention yields greatest benefit.
Pros and cons. Pros. Ticagrelor is a potent antiplatelet agent that reversible binds and inhibits the P2Y12 receptors of platelets and indirect acting in contrast to clopidogrel, the actions of which is dependent of variable and genetically determined metabolic activations, is used for the prevention of thrombotic events in people with acute coronary syndromes or myocardial infarctions with ST elevations. Ischemic stroke and transient ischemic attack are common, and the risk of subsequent ischemic events is particularly high during the first 90 days after the index cerebrovascular event. Cons. The benefit of aspirin in the secondary prevention of ischemic stroke is limited even with concurrent aspirin treatment. The rate of recurrent stroke is 10 to 15% in the first 90 days. In the rate of new ischemic events when the aspirin is used in the long term is only 20% lower than the rate associated with non-preventive treatment. Even moderate doses of aspirin are associated with relative risk of hemorrhagic events, including gastrointestinal bleeding.
Ticagrelor is an antiplatelet therapy that is an alternative to aspirin for preventing recurrent stroke. In a large international double-blind trial, 13,199 patients with non-severe ischemic stroke or high-risk transient ischemic attack, or TIA, who had not received thrombolysis were randomized to either Ticagrelor at a dose of 180 milligrams once, followed by 90 milligrams twice daily, or aspirin at a dose of 300 milligrams once, followed by 100 milligrams daily. These regimens were started within 24 hours after the onset of symptoms and were continued for 90 days. The primary endpoint was time to occurrence of stroke, myocardial infarction, or death within 90 days. 6,589 patients were treated with Ticagrelor, and 6,610 were treated with aspirin. The primary endpoint occurred in 442 patients in the Ticagrelor group and 497 in the aspirin group. The authors therefore conclude that Ticagrelor was not superior to aspirin in reducing the primary composite outcome of stroke, myocardial infarction, or death in patients with acute ischemic stroke or TIA. Full trial results are available at nejm.org.
Issue applied in Ecuador. Ticagrelor may be a more effective antiplatelet therapy than aspirin for the prevention of recurrent stroke and cardiovascular events in patients with acute cerebral ischemia. In Ecuador, out of 100,000 people, and 1,373 have blood pressure problems, so says the report. 2012 World Health Organization. Each year, the disease kills 9.4 million people worldwide.
The stroke, sometimes called a brain attack, occurs when blood flow to the brain is interrupted. That can happen if a blood vessel breaks or gets blocked by a clot. When someone has a stroke, brain cells in the immediate area begin to die because they stop getting the oxygen and nutrients they need.
What you're seeing transpire is that somewhere in an artery or the heart, a blood clot forms. A common site is the internal carotid artery. The artery becomes irregular because of atherosclerosis. That's a favorite site for it to happen. The atherosclerosis can go ahead and block off the blood vessel and cause a stroke. But another thing, probably a more common thing that happens, is because of the irregularity, a blood clot forms there. Now this clot can enlarge and plug off that major blood vessel to the brain, but often a small part of the blood clot will break off in the turbulence of the blood flow back and forth, and then the blood clot travels along with the blood and lodges in a blood vessel inside the brain. And that is when the moment of a stroke starts. The clot breaks off, takes a few seconds to travel to the smallest blood vessel it can possibly fit into, and then the blood flow suddenly stops to that part of the brain. And then within a few seconds, all the oxygen and glucose are used up, and the rapid transition to permanent injury and the actual death of that part of the brain is on its way. Within a few seconds.
Conclusions. In conclusion, in patients with acute ischemic stroke or transient ischemic attack, Ticagrelor was not found to be superior to aspirin in reducing the risk of composite endpoint of stroke, myocardial infarction, or death. There was not evidence of a higher risk of major or intracranial hemorrhage with Ticagrelor than with aspirin, but there were more instances of dyspnea and minor bleeding in the Ticagrelor group. Nearly half of the stroke occurs within the first few days after or TIA, and symptoms for TIA are the same as for a stroke.
Known as TIA is referred to as a mini stroke and is often a warning sign of a possible impending stroke. Dr. Frida Lewis Hall, the Chief Medical Officer of Pfizer, and I are going to give you some tips on how to recognize it.
Now, TIA occurs when blood flow to a part of the brain decreases or stops for a brief period of time. It can happen to anyone at any age.
Symptoms are similar to a stroke. They can appear suddenly. They may include anything from numbness or weakness, especially on one side of the body, confusion, dizziness, trouble with your speech, vision, or walking.
And symptoms can last up to 24 hours, but in most cases they only last 1 or 2 hours. TIAs are temporary, unlike a stroke, and don't usually cause impairment.
If you do have any of these symptoms or see them in someone else, please call 911. If diagnosed, TIA can serve as an opportunity to take steps to prevent stroke.